I would like to welcome you all on behalf of Independent Research Ethics Society, Ayush Samriddhi Gyan Ganga, at the milestone of 2380, Technology for Health and Peace. We would like to welcome Professor Suparna Sanyal Mukherjee Madam from Bolpur and Dr. Sakat Kumar Basuji from Kolkata in Canada. Welcome Sakatji, welcome Suparna Without wasting much time, I would like to request you to guide us on technology, how it is beneficial for health and peace. Thank you, Dr. Suparna, Madam. I would like to welcome Dr. C.P. Sharma also. He is a ex-joint director of ISM, Government of MP. So concluding remarks, I will request from him. Dr. Suparna Sanyal Mukherjee, Madam. Welcome.
Very good evening. Thank you, Dr. Pavan Sharma ji. Thanks for giving me another opportunity to say on this auspicious platform. And this topic is also very important, and it is a time-friendly topic, which is the technology, healthcare, and peace. Basically, we are surviving in the world of technology. If there is no technology, we cannot do anything. Right at this moment, we are also using technology. So technology is a science, technology is a point, and technology is a behavioral aspect where we are surviving in right at this moment. So technology has given us more potentiality in each and every aspects of our life, especially the healthcare. And healthcare, it is a very important portion of our life sustainable, because without caring of health, we cannot do the anything. So healthcare is a part and parcel of our life. Where the healthcare is there, that means the technological orientation. Our doctors, previously doctors were prescribe you and detect the diseases, which disease we are suffering from. But nowadays, if we cannot use the technology, if we cannot do some tests, the laboratory tests, which is based on the technology orientation, so the doctors cannot give you the prescription, and he or she cannot write any medicines without having the technological feedback. So technology is a science where it is uh, absolutely depending upon us, and we are just the creative robot. That means we have the brain, we have the sensation, we can think, we can reasoning, and we can form, we can make it applicable, and we have the implementation process and everything. But we also create the technology and technological motivation where we are sustaining right at this moment. So in that cases, we can say that the technology is a voice, technology is a symphony, technology is a piece, because wherever we used to go, if there we would not get the feedback, this feedback is giving us the peace. Why? So if the blood sugar level, according to technology, is high, so the doctors will prescribe you the blood sugar medicines. And when on the basis of this technology, when the blood sugar is normalized, become the stable, so it is give us the mental peace. So doctor also prescribe the medicines. The continuation and institutional treatment used to be started after getting the feedback from this technology orientation. That's why we can coincide this technology piece and modern age and modern era is giving us the sustainable orientation along with the life sustainability, especially for the healthcare system, the health activities, health procedure, health medicines. Everywhere is technology nowadays. This is also incorporating, which is getting very important, and it is also interesting, that the telemedicine. So if you can make the appointment, if you are not getting and you are not getting appointment from the doctor, and you are so far, there is no scope for the going to this hospital right anytime, any moment. So you can take the support from the health medicine, the health doctors through this the internet connection, and what relation we are surviving, like it's through the Android or the iPhone or the computer, email, whatever. So if you have the network chain, and if you have the chain network, you can emphasize, and you can compose, and you can get the medicines, you can make the cure, then only you can go to the doctors, and then the technology you can apply. So technology, before applying technology, our first step system is interestingly abolished, because we have learned from the NCC and scouts and guides where the first aid is very important. So first aid, when we are just abolishing this first aid, and we are also depending upon this technology, what technology is telling, and what is the feedback, what is the result, and then only we can apply medicine. So the IQ, when we are reasoning, our IQ level is also restoring our sensation and our learned behavior, learned learnage, but it is not yet been applicable without the technological feedback. So that's why the Ayush is very important over here. Though we have the Ayush hospital, Ayush, OT, Ayush medicines, Ayush chemical orientation, Ayush medicines through the chemical, everything is there. But we have forgotten, and the development of the Ayush is also basically depend upon this technological orientation. If we can, that's why it is getting so interesting and so good for the all over the world. That's Ayush is emphasizing on the technology, and technology-based medicine is applying by this Ayush doctor. That's why it is also very important for us, because there is the surgery is also doing for this Ayush, because technology is implemented. That's why it is also very important for the Ayush treatment too, or developing. And homeopathic also, it has been started for this the OT and this operations, whatever. So that's why it is the other treatments also encouraging us. The technology also encourage the doctors and the patients for the better treatment and better sustainability of life, for this better medicine and application of the technology with peace. Because when everything is all right, if the patient is all right, the doctor's prescription medicines is shooted to this patient, and the patient party is getting all right, and they also get the peace, and the patient family. So that's why it is very important, and to this juncture, it is very important and highlighted and burning topic to apply the technology in the healthcare system, getting peace and the sustainable life. Thank you very much. Thanks for giving me such an opportunity. Thanks a lot.
Thank you very much, madam. Thank you very much. Today, connection of the net is excellent, and your speech is all. आप कलकत्ता में हैं?
ना, हम हावड़ा में है, तो इसीलिए इधर तो कोई प्रॉब्लम नहीं है। और बोलपुर में प्रॉब्लम क्या है, अगर बारिश हो जाए कुछ पल के लिए, बस लोड
ओहो,
शेडिंग एंड लोड शेडिंग, and there is no electricity and no network, so very difficult situation over there. So it is the suburb,
ओहो,
that's why. And Howrah is the metropolitan, because it is the twin city of Kolkata and Howrah. Thank you, sir. Thank you very much, sir.
थैंक यू मैडम, सो नाइस ऑफ यू, सो नाइस ऑफ। मैं अब डॉक्टर शैकत कुमार बसु जी को सादर आमंत्रित करता हूँ उनके विचारों के लिए।
Thank you, Sharma ji. I think Madam has very nicely illustrated the importance of peace and technology, particularly with the development of technology, how it is shaping. I am only going to highlight it with little respect to the Ayush platform. I think today, where the Ayurvedic study stands, or the research and investigation stand, is indeed post-COVID, we are in a splendid opening and opportunity. It is now our responsibility to push this the treatment process and the Ayurvedic studies, along with the all other alternative medicine, to give it a highest push because it is increasingly has become popular around the world. And particularly in India, we need to, I personally feel that it needs to be a little bit modernized. And modernized how? By including some integrated areas of modern medical sciences that could be integrated, I personally feel, should be integrated with Ayurveda to make our Ayurveda practitioners more empowered to treat the disease. How? For example, there are so many beautiful treatments about osteoporosis, arthritis, and various other osteological challenges and problems that we face in our daily life. Ayurveda has excellent recommendations for that. Even if you have a fracture and stuff, there are so many good medications, so many good processes that we need to follow. But what about teaching the Ayurveda practitioners also to read X-rays? Like, this is already available in many institutes and stuff, but particularly I have seen there is a negative feeling about integration of modern practices in Ayurveda, particularly in the Hindi belt, comes from Rajasthan, Madhya Pradesh, Uttar Pradesh, and other areas, that any integration of modern science and technology of integrating them into Ayurveda is making Ayurveda ashuddha, that it is no longer the pure traditional knowledge that we have. We are adding impurity to it. I strongly strongly oppose this view, and I feel that if our Ayurvedic practitioners are also trained in parts, and either in their undergraduate or in their postgraduate degree qualifications, to learn about the biochemical test, like what is your creatinine level, what is your blood sugar level, what about the test that deals with the sodium potassium ratios and stuff, I think it will empower Ayurveda practitioners even more. If you know how to read an X-ray, if you could exactly see where the fracture is, how deep the fracture is, how bad the fracture is, or how simple the fracture is, you can formulate your medication and your treatment even better. I would go even further. I would suggest that Ayurvedic practitioners should know even treatments of like how to read MRI sheets also, like for say various other neurological problems and stuff, various other bodily ailments. CAT scan, MRI scan, all these modern technology which are available is becoming increasingly available to the people. There are opportunities to study and learn and know how to read them. Only if you could read them, and which is not like our rocket science for anyone. If technicians could read and identify who are not even trained doctors and give you a direction that with how bad the condition is, or even a picture of the Doppler state of the heart and things like that, why is it bad? Like, why Ayurvedic practitioners should resist it, saying that it is adding Western education and science to Ayurveda? I think it only further increases the application of Ayurveda in various other areas. I have been in China and I see that they do a lot of these acupuncture and other diseases. Doctors there are very frequently referring to X-ray plates, MRI scans and stuff. They're even asking you to undergo medical chemical tests or blood tests and stuff. When once you come up with your report, they are treating with you with more precision, with more long-term relief and long-term impact. If you could see that through an ultrasonography, how bad is the storage of fat in your abdomen or your liver, non-alcoholic fatty acid, there are no very good treatment in case of allopathic medication. The best treatments are available with Ayurveda. But if the doctor can comprehend and understand through an ultrasonography how bad it is, then I would think that he or she would be better empowered to prescribe Ayurvedic formulation much better. And it is also important to know how the patient is doing better. So, for example, if you have treated someone, 1 year has passed away, the patient is looking healthy and is coming back, it is important to document how this liver picture has changed, how the fat has reduced, or how the blood profile has changed. These needs documentation. We only include, we know what the patient interviews, which I don't think in these modern days and time is useful and acceptable enough. Saying my patient has done wonderful, they came with this broken hand and I have repaired them and they are now doing as good as a gymnast and stuff. These are fantastic claims, but needs to be documented, and it could be easily documented by having the picture of the patient before and after the treatment that is done in any other medical treatment. So once we start documenting them, once we have our Ayurvedic practitioners also using these diagnostics tests in understanding and assessing the internal conditions of the patient, I think we will empower Ayurveda with technology even more. It would become successful even way beyond allopathy, because these are long-term treatments with little or no side effects. So it is very important for doctors to understand what are if there is a tumor related problem. If you could read an MRI, you are empowered to understand how deep the tissue has been impacted, what part of the body has been impacted. Just by listening to the patient, I am having rash here and pain there, is not good enough for proper diagnosis, as I understand. It is important to look into those internal pictures. The colon pictures or the colonoscopy and stuff, all these internal diagnostic pictures that gives us an alignment of the internal bodily system, the pictures of the tissue sections and how they are deteriorating or improving, is only going to improve the quality of treatment, the confidence of the doctors, even the treatment that they're giving. If it is subsequently changing after within few months and stuff, what a joy it should be to demonstrate that by tissue sections it shows that the condition of the liver or the condition of the heart or the Doppler test pre and post treatment indicates that how better you have undergone this treatment. Now, one of the objection to this is that the cost of this test, which I totally agree, that cost of the test has been accumulating. There are innumerable complaints among the patients that many allopathy doctors who are recommending these tests are not actually needed. Recently, one of my relative is undergoing and what you call a gallbladder surgery, and she had a blood-related ailment. The doctor has prescribed what you call a $1,500 thalassemia test. She is 70 years old. She has passed our entire life. She has 2, 3 kids. She does not need a thalassemia test. You can well understand the doctor is getting a commission for prescribing such irrelevant tests. I do strongly protest about this, but at the same time, under the government hospitals and stuff, there are pathological tests. I have seen our postgraduate institute of Ayurveda in Kolkata. They have extra facilities and simple blood and other related tests made available here, so that patients can get free reports and can report to the doctor so that they can treat them with more confidence. It is important that we look into how to bring down the cost, or how the hospitals, even in Ayurveda hospital, could set up and have a blood clinic and integrated heart clinic and stuff, where they could utilize ECG reports and stuff that is made available to them. And if they can read it, I think the treatment can good skyrocket it and change the face of Ayurveda and make it an international success over time. So my strong recommendation and request to all Ayurveda practitioners is, like, I know that there are many modern viewed people who want the aspects of modern technology to be integrated with Ayurveda. And there are also orthodox people who are totally against the incorporation of any modern medicinal aspects into Ayurveda. I strongly believe that it is important, it is impossible for humans to stop the progress of computer, to stop the progress of technology, to stop the progress of AI technology that is made available. Today or tomorrow, it will come and get integrated in your discipline. Please be open. Please welcome the new technology with open heart. Make the subject more integrative, more international, more acceptable, and more intensive, in the sense that you are able to see the inside of a human body with more precision, perfection, so that your treatment can also be high durating and the best in the world. Ayurveda has huge potential to use this technology and become one of the fast track, most advanced medical system down in the line, if such modern aspects of treatment are being integrated. I'm not asking allopathic medication to be included within Ayurvedic formulation, but just a study of X-rays and other plates or heart disease and other elements, ECGs and things. People need to know, even for the nerve tests, there are numerous nerve tests that are being done due to these days, and these particularly highlight which nerves, what part of spondylitis you are suffering and stuff and things like that. All these tests are made available. Of course, many of them are expensive, but sometimes we have no other choice but to go through these diagnostic tests to identify where specific the problem is originating, and then to formulate the specific treatment that the individual patient needs. With this, I conclude my presentation. Thank you very much, Dr. Sharma. for providing me this opportunity.
थैंक यू वेरी मच, डॉक्टर शैकत। आप हमेशा एक फ्लो में अपनी स्पीच देते हैं। आदरणीय डॉक्टर सीपी शर्मा जी को मैं सादर आमंत्रित करता हूं। आदरणीय सीपी शर्मा जी, मैंने आपके पास डिजाइन भी सर भेजा है कल के लिए। कल हम वहां पे रख रहे हैं, कल मदर्स डे है। आदरणीय डॉक्टर सीपी शर्मा जी, डिजाइन काइंडली जरूर देख लीजिएगा।
जी पवन जी नमस्कार। सभी आज के वेबिनारों के वक्ताओं, शर्मा एनडी शर्मा साहब, शौकत जी, मैडम, और इससे पूर्व में मैडम पारुल जी, सभी का बहुत बहुत धन्यवाद। अभी अभी जो बात चल रही थी, मॉडर्न टेक्नोलॉजी को एक्सेप्ट करते हुए आयुर्वेद के विकास की परिकल्पना। आज के वैश्वीकरण, ग्लोबलाइजेशन के उसमें हमें ये निश्चित ही शौकत भाई की जी की जो भी बातें हैं वो बिल्कुल फुल्ली एक्सेप्टेड हैं। आयुर्वेद ने हमेशा, चाहे वो भागवत का काल रहा हो या माधव कार का काल रहा हो, समयानुकूल, उपयोगी एवं व्यावहारिक व्यवस्था को आत्मसात करते हुए नई अपनी नैदानिक और चिकित्सकीय व्यवस्था का समायोजन व्यवस्थापन चिकित्सा के लिए किया। हमारे साथ क्या हो रहा है सर? कल आपका भी कष्ट था, मेरा भी यही कष्ट है कि हमारे पास पहले जब जो हमारा कार्यकाल था उस समय आर्ट्स के लोग आते थे। वो एक प्री आयुर्वेद चला था, उनमें न तो हार्ट की संरचना का पता था, न सेल का पता था, और वो जिस लेवल के थे उस लेवल पे वो प्रैक्टिस कर रहे। उसके बाद फिर अभी वही काम हमारे, चाहे वो केंद्र शासन की बात करूं, राज्य शासन की बात करूं, प्राइवेट कॉलेजों में 80% बच्चे केवल और केवल डिग्री लेने आते हैं, जैसा कि आपका बताया था आपने। तो हमारा जो टीचर है सिद्धांततः अपनी विद्या का जो ज्ञान देना चाह रहा है उसको आत्मसात करने के लिए कोई है नहीं। अब रही बात मॉडर्न के साथ कोलैबोरेशन के लिए, मॉडर्न को तो ठीक है, शासन ने कह दिया कि 6 महीने की आयुर्वेद ट्रेनिंग करोगे, वो तो, और अभी 20% आयुर्वेद लिख रहे थे अपने प्रिस्क्रिप्शन में, अब वो 50% लिखने लगेंगे। हमें, हम लोगों को अपने आयुर्वेद के वास्तव में कर्णधारों को डायग्नोस्टिक टूल्स, मॉडर्न टेक्नोलॉजी को एक्सेप्ट करते हुए, चाहे वो निदानिक व्यवस्था में हो, डायग्नोसिस में हो, चाहे चिकित्सा में हो या मैन्युफैक्चरिंग में हो, हमें सब पूरी टेक्नोलॉजी को तो आत्मसात करना ही होगा। यह समय की मांग है। इसके बाद, इसके साथ साथ हमको ज्ञान पूरा होना चाहिए, तो और केवल एक जगह हमें वो करना है कि हमारा जो चिकित्सकीय व्यवस्थापन हो, हमारा ट्रीटमेंट हो, वो आयुर्वेदिक हो। उसमें हमें ड्रग चाहिए, तो औषधि निर्माताओं से ये निवेदन रहेगा कि वो अच्छी ड्रग बनाए। अब देखिए शासन की व्यवस्था, शासन की उदासीनता, ये सब, चाहे वो आयुर्वेद विद्यापीठ हो या और कोई भी हो, उन्होंने ट्रेडिशनल वैद्य अपने बच्चों को, अपने परंपरा को जागृत रखने के लिए उन्हें कोई मतलब नहीं उनके लड़के ने क्या उसका ज्ञान है, क्या उसकी कैपेसिटी है। उन्होंने अपने इसके लिए एक लाइन निकाल ली, उन्होंने इसके लिए एक व्यवस्था निकाल ली। परिणाम क्या होता है? एक तो हमारी शासन ने ही हमारी डिस्पेंसरियां ऐसी आइसोलेट कर दी हैं, इतनी ग्रामीण क्षेत्र में डाल दी हैं कि वहाँ हमारा वैद्य है, उसका जो पेरिफरी है, उस पेरिफरी में बिल्कुल संकीर्ण विचारधारा के नैरो माइंडेड लोग उसके सर्किल में आते हैं। अब रही बात कि आयुर्वेद गरीब की चिकित्सा व्यवस्था ही नहीं है, वहां हमें अपने जो डिस्ट्रिक्ट लेवल पर संभाग लेवल पर या प्रदेश की जो अच्छे इंस्टीट्यूट्स हैं उनमें हमें व्यवस्था को बढ़ाते हुए डायग्नोस्टिक टूल्स को, मॉडर्न टेक्नोलॉजी को एक्सेप्ट करते हुए आयुर्वेद की परिकल्पना करना चाहिए। इसके लिए हमें, ठीक है, शासन चाह रही है कि हमें चिकित्सक चाहिए, रिमोट एरिया में वो हमारी पोस्टिंग कर देती है, और हमारा वैद्य जो बीएमएस फाइनल में पढ़ के जाता है उसके बाद आगे वो पढ़ना ही नहीं चाहता, वो जानना ही नहीं चाहता, वो उसी में उसकी चली जाती है। तो हमें निश्चित ही, पहले क्या होता, जब हमारे टाइम पर, आपको भी पवन जी याद होगा, दो ग्रुप चलते थे पूरे इंडिया में, बीएचयू लखनऊ ग्वालियर, ऐसा एक ग्रुप हुआ करता था, जामनगर, जयपुर, ये प्योर आयुर्वेद और इंटीग्रेटेड आयुर्वेद। तो इंटीग्रेशन बिल्कुल एक्सेप्टेड है, वह शर्त है कि ट्रीटमेंट में इंटीग्रेशन नहीं होना चाहिए, ट्रीटमेंट प्योरली हमारा आयुर्वेदिक होना चाहिए। हमें अपनी औषधियों की गुणवत्ता को बढ़ाते हुए डायग्नोस्टिक टूल्स, मॉडर्न टेक्नोलॉजी का पूरा भरपूर उपयोग करें। कौन कहता है? वो क्या एलोपैथी की थोड़ी है, वो तो हम फिजिक्स की देन है, वो हमारी साइंस की देन है। अपन उसको यूज करके परफेक्ट डायग्नोसिस करके बढ़िया से बढ़िया रेमेडी दें आयुर्वेद की। उसमें हमें ये टेक्नोलॉजी को, चाहे इंटीग्रेशन अशुद्ध नहीं होना चाहिए, इंटीग्रेशन भी शुद्ध हो, आयुर्वेद का ट्रीटमेंट भी शुद्ध हो, ऐसा मेरा जो सोच है। उसमें नैदानिक, चिकित्सकीय, औषधि निर्माण, नैदानिक में कोई भी परीक्षण हो, किसी लेवल का परीक्षण हो, इसमें हमें फुल्ली जो रिसेंट टेक्नोलॉजी है उसका जो साइंस स्ट्रीम के छात्र हैं वो पूरा उपयोग करते हैं, आर्ट स्ट्रीम के छात्र नहीं करते, न जानना चाहते हैं, न वो कर सकते कि एक्सरे क्या होता है, क्या कहाँ क्या मिलेगा। तो हमें अपनी भावी पीढ़ी में ही जागृति लाना पड़ेगी, उसी को बताना पड़ेगा। हम ये न सोचें कि हमारे यहाँ 100 छात्र पढ़ रहे हैं, हम उसमें से 20 ही छात्र तैयार करें, 10 ही तैयार करें, 50 ही तैयार करें, पर वो आज की आवश्यकता के अनुरूप हों, जो टेक्नोलॉजी के साथ साथ आयुर्वेद को भी, सिद्धांततः है जो आयुर्वेद का उद्देश्य है, उसके उद्देश्य परक ज्ञान रखते हुए चिकित्सकीय व्यवस्था में पारंगत रह चिकित्सा करें। इन्हीं शब्दों के साथ पवन जी, बहुत बहुत धन्यवाद कि इतने इतने अच्छे वक्तव्य, व्याख्यान आते हैं कि हम आज भी ये चाहते हुए भी कि नहीं, हमें इनसे भी बहुत कुछ मिलता है। आज जब हमारा पूरा वैश्विक ग्लोबलाइजेशन, ग्लोबल लेवल पर वैश्वीकरण में हमें आयुर्वेद को एक अहम रोल अदा करना है, उस स्थिति में हमको सभी विद्या में, दोनों विद्याओं में पारंगत होती हुए चिकित्सकीय विधा में, चिकित्सा के ट्रीटमेंट में आयुर्वेद का सहारा लेना चाहिए, आयुर्वेद का उपयोग करना चाहिए। ये आयुर्वेद चिकित्सकों का मौलिक आधार होना चाहिए। इन्हीं शब्दों के साथ धन्यवाद पवन जी, ढेरों शुभकामनाएं आपको।
कल आपका आशीर्वाद चाहिए वंश को। कल मेरी प्यारी भारत माँ, मैंने टॉपिक रखा है ऑपरेशन सिंदूर से प्रभावित होकर। बहुत बहुत आभार आपका।